Hi everyone, thanks for joining us today. My name's Karen, I'm a nurse educator with the Rural Support Service. Today we're going to be doing the TPPP information session for the regional local health networks. We've got a PowerPoint that we're going to go through, and from there hopefully we'll address any of the concerns or questions that you might have. If for whatever reason we don't cover those points, you're welcome to make contact via email with the Rural Support Service again. And hopefully we will be able to work with you and help either answer your questions or direct you to the person who will be able to help you. Here we have, as I said, the title page here about the Regional Local Health Network's Transition to Professional Practice Program for 2021. I'm an acting nurse educator with the Rural Support Service in the clinical development team. I'm also very passionate about working in regional areas. I undertook my TPPP in a rural hospital more than 20 years ago now. If you look here, we have a little map of the regional local health networks in South Australia. So you can see here, it's a very busy looking map. There's 6 of the regional local health networks in the state. There's also 4 metropolitan local health networks, so there's 10 across the entire state. For South Australia, our regional local health networks cover 983,000 square kilometres, and we provide service to over 500,000 people. That's incorporating residents and people that visit to the regions. If you have a look here, these little maps, it identifies where the kind of border for each region is. So the Barossa Hills Fleurieu is the little green section in the middle, which incorporates Kangaroo Island as well. York and Northern is the maroon section, which covers the York Peninsula and extends out to the border through the mid-north. Limestone Coast is Mount Gambier, Kingston, Naracoorte and Bordertown, so right down the bottom there. Riverland Mallee Coorong is the orange section, just above the Limestone Coast there. Flinders and the upper north incorporates Port Augusta, Whyalla, Corn and Roxby Downs hospitals. And then Erin Far North, which is by far the largest physical size regional health network, incorporating Ceduna, Woodner, Kimber, Cow and Port Lincoln hospitals, which all offer TPPPs. This is a breakdown of the 2020 TPPP places that were available. This year is trending that it's going to be pretty similar. There might be 1 or 2 extra places or 1 or 2 less places. There's still requisitions coming in for that. So Barossa Hills Fleurieu offered 10 positions over 6 different sites and incorporated some rotation between health services. York and Northern have 9 sites and offer a total of 14 positions. Same thing, Port Pirie offers a rotation between it as a base hospital and then out to some of the smaller sites. Limestone Coast has 4 sites and offers 32 positions. So Mount Gambier has the highest intake of TPPPs for the year, and they do 3 intakes across the year. So there's an intake at the start of the year, intake in May or thereabouts, and then again in September, October. Riverland Mallee Coorong have 4 sites and offers 7 positions across those. Flinders and the Upper North, 16 positions over 4 sites. Flinders and Upper North incorporate 2 fairly big hospitals there. And then Erin Far North have 5 sites and offer 8 positions. Here we have some stuff about what you can expect from a regional local health network TPPP. So every TPPP RN is supported by clinical facilitators, preceptors and buddy nurses. The program offers some orientation days, so it's generally 1 to 2 orientation days just to walk around and get a feel for things, maybe do some online learning so that you upskill a bit in what the policies for certain things are. Then there's a couple of buddy shifts, so where you're working supernumerary or allocated next to someone to work with you. And this is usually between 2 and 5 shifts, depending on what the workforce needs are and how you're managing with that. It could be extended or it could be left at just the 2 days. Study days, there is a requirement for a minimum of 4 study days to be offered for TPPP RNs. Some sites do offer more and some sites will incorporate other learning opportunities for you also. Port Pirie currently is offering 5 as part of their program. Experiential learning opportunities. So with this, an experiential learning opportunity, there is a minimum of 12 days that is allocated within your contract. The days where you're additional to your rostered numbers, and you have the opportunity to work in an area that you might not be confident in working in or might not be familiar with. So examples of that might include things like working in the emergency department, where you have the full cohort of rostered staff and you're additional to that, and it's an opportunity for you to have some exposure to it and to upskill. Other places that people often do experiential learning include theatres, community health, community mental health, and those kind of specialised areas. Some sites also use the experiential learning days to help support people to learn the necessary role of a team leader, so that you're not going into it blind when it is your turn to be the team leader. You've had some exposure and some support in getting in there. With the TPPPs, there's also potential for rotation to other sites and services within the region. So as I explained, some of the bigger hospitals do offer rotation out to smaller hospitals. There is also, with some of the bigger hospitals, you will rotate between different wards. So you might be in the medical ward for a while, then surgical ward, or in the emergency department, things like that. Within the program, there is also opportunity to ask for rotation. It might be that your experiential learning opportunities could be done in a different hospital. If you're in a small hospital and you want to see some bigger emergency department stuff, then you can ask. All it is a question, and you can ask whether that's a possibility that it might be able to be facilitated for you. The other thing as well with the Rural Local Health Network TPPP is that your rosters are over 7 days, and it's any shifts in a 24-hour period. So as a student, you would have become very au fait with the whole early, late night routine. That's the norm. The truth is, once you're out in the workforce, that can be a bit different depending on where you're working. A lot of sites will incorporate different shifts to meet their workforce needs. So for example, some hospitals will have more of a daytime shift that goes from 9 until 5:30, or some sites are now incorporating an 11 till 7:30 shift, because that helps to support the staff that are on to get their meal breaks properly and to make sure that there's cover for them while they're writing their notes and things like that. So what you know as normal could be a bit different once you're out in the workforce. The benefits of undertaking a TPPP in a regional local health network area are pretty good. So the first point here is that you will develop generalist skills which are transferable almost anywhere. So with that, if you were to undertake a TPPP in a highly specialised ward, it means that you know everything about that one particular illness or one particular body system. For regional areas, you end up knowing a bit about everything as a point of necessity. So the really key skills that you will take away that will make you highly employable in other places are your assessment skills will become finely honed. You'll be very good at looking at people and knowing, yes, this is important and needs to be dealt with immediately, or yes, I can prioritise that a little bit further down the line. Working right alongside those assessment skills is also your problem solving and your critical thinking skills. In a regional area, there isn't a team of people that will come and fix a problem. You're the one that needs to solve the problem. And your problem solving might be from as simple as the patient's TV isn't working, or it could be that the patient's blood pressure won't resolve. What are you going to do? What are your nursing steps that you're going to take to try and revert that? Your critical thinking skills are highly sought after. It's one of the requirements of registration is to be able to demonstrate critical thought. And I might be biased, but my personal opinion is that working in a rural or a regional hospital gives you those skills. It helps you to develop that more simply because, once again, you are the problem solver. You are the one that needs to come up with the ideas and address what's important at that critical point in time. Other benefits include opportunities to see and do things that might surprise you. So for some people, they're really locked in on what type of nurse they want to be. For me, I wanted to be a flying doctor nurse. I was focused on that. That's what I wanted to be, until I got out to a rural area and had to assist with delivering a baby. And then I went, oh no, that isn't for me anymore. So that changed what my goal had been. It changed because of the experiences that I had. And that was surprising for me, because I was pretty certain that's what I wanted to do. And with that, following on from that, is you have personal and professional challenges that you'll face. You might say, well, why is a challenge a benefit? But the thing is, challenge promotes growth. Challenge encourages you to extend and do things that might not be in your comfort zone, but actually help build your career, help build your professional and personal identities, things like that. So examples of this could include, like for a personal challenge, it might be for some of you, you're looking at a TPPP that's away from home. It might be somewhere different that you haven't been, somewhere that you are unfamiliar with and is away from family. So you don't have that support network. That's a personal challenge that you're taking on in order to better yourself and get the career experience, things like that. Professionally, for a lot of smaller rural areas, you're very well recognised. People will often know who you are before you're even in town. They say, oh yes, you're the new nurse that's coming to the hospital, and things like that. So there's some professional challenges that come in there about coping mechanisms and identifying your boundaries. You don't want to necessarily be at the supermarket and have everybody want to come and talk to you about their medical problems. So it's about identifying what are your skills that you need to be able to limit that and keep your own time for yourself. These are all skills that you will develop if you come out to a regional area to do your TPPP. Here we have some pictures of some of this year's candidates and what they've been undertaking. So up on the top left there we have Holly. Holly is the TPPP out of Ceduna this year. She was an enrolled nurse at Ceduna, so is doing a transition through to her TPPP there. In this picture, she is practicing the intubation process necessary for COVID patients. So you can see in the background there's a big extractor fan in the window, and she's fully dressed in her PPE, ready to undertake the intubation process. In the next picture on the right here, we have Belinda and Mona. So Mona is the clinical facilitator at Wallaroo, and Belinda is the TPPP who has been at Balaclava this year. Belinda identified that she wanted to have some more emergency nursing experience, so came to Wallaroo for her experiential learning day. She did a block of 4 days, and she did some things that she found quite surprising. She'd been here for 1 day and then was involved in delivering a baby, things like that she hadn't considered before. Down the bottom there is just a picture of the desert peas that you can see on your days off if you're up in Roxby Downs. Then over here, this is Natasha and Darcy, who are both out of Woodner. So Natasha is an early career RN. That means she's a level 1 RN who is not in a TPPP, whereas Darcy is in a TPPP. And here they're just looking through the resus trolley and things in the resus room. Here are some of the questions that you might want to know. So these are things that lots of people ask questions about. So will I have to work night shifts? The answer is yes. As I said before, you work over a 7-day roster over a 24-hour period. Some sites have policies on how many months you're there before they put you on night shift. Some places are comfortable having you on night shift working with another registered nurse within the first 4 to 6 weeks. It just depends on what each site is doing. Will you work on your own? Well, you should never be completely on your own. You should always have somebody working with you in regards of an enrolled nurse or another registered nurse. In the EB agreement, there is actually stipulation that for a first-year registered nurse, whether you're in a TPPP or not, you're not to be the sole registered nurse in a practice area for the first 6 months of your employment. So there is protections around you. So eventually you will get to the point where you might be the only RN in a area of practice. but it won't be for a little while until you've developed some skills and start to feel a bit more comfortable about things. If there's an emergency, places will have on-call staff that will come in, or on-call management that you can call in. In the background of this photo of Darcy and Natasha, you can see there's like a TV screen looking thing, and that's got a little grey camera up on the top. That is a emergency tele network that exists. So if something happens, that camera will actually allow MedStar, who's the medical retrieval service in South Australia, to actually visualise your patient. They can be in the room digitally with you doing patient assessment and undertaking things. And the cameras that they use are so high tech that they can zoom right in and see hairs growing out of freckles and all sorts of things. So if there's an emergency, there is people that will be around to help you, even if you are the only RN on site for the commencement of the emergency. Is there always a doctor around? There's always a doctor on call, and if there's not, there will be some system in place that there will be another doctor that will cover, whether it be a locum doctor or through the SAVES digital telehealth network, cameras, things like that. There will always be somebody that you can talk to confirm your clinical assessment and things like that. In regards to the study days, all of the regions except for one tend to do a centralised study day. So where the study days are held at one of the bigger hospitals in the region, and everybody travels from around the region to that site to undertake a study day. The exception to that is in the Barossa Hills Fleurieu region, where the TPPPs will travel from town to town for their study day. So the first one might be in Gawler, the next one down at Victor Harbour, things like that. And they just rotate through the sites in the region. Something to consider is, particularly if you're moving away from home, moving to a new town, where are you going to live? It sounds like such a funny question, but for some towns, rentals are hard to come by. So that is something that you need to just have in the back of your mind. If you're going to relocate, what's your living arrangements going to be? Some sites do have hospital accommodation where you might be able to access it for a short period of time, and that's just as much as making a phone call to ask those questions to the contact person that's listed on the TPPP information sheet. The next point here is, what if I don't get a position? Across the state, there's, I think, about 900 applicants they're predicting for the year, and there's less than 500 TPPP positions available for registered nurses. So that means 1 in 2 or thereabouts will not be successful in obtaining a TPPP. And I know that's frightening for a lot of you. You would have been built up to think that TPPP is the penultimate thing, and if you don't obtain one, then you've failed somewhere in the system. That's not the truth. The truth is that a lot of hospitals are employing early career RNs, such as Natasha here in this picture, and they're doing that out of necessity. Their workforce is decreasing in size, so they're having to take on staff and support them to upskill to be good registered nurses in their hospitals. So if you don't get a position, it's not a matter of giving up. You just need to then consider your options. Make some phone calls. If you are living in Strathalbyn and you applied in the Barossa Hills Fleurieu region and weren't successful, it's just a matter of making phone calls. Can I join your casual pool? I'm a newly graduated RN. Can I do this? Can I pick up some shifts in aged care? Things like that. If you don't get a position for the 2021 period, you can apply in the following year. However, there are limitations on the number of hours that you've worked as a registered nurse before you're able to apply. So that's just something to consider as well. You need to just plan that in your decision making. The other question that has come up a few times, which I don't have here on the slide, but people have asked a lot about the FTE of the TPPPs. So across the regions, every worksite is different, and they offer a TPPP based on what shifts they have available, what their availability is. Some sites offer 0.6, and then some go up to 0.8, and there may be some that are full time. So if you are needing to work to survive. You need a certain level of income, things like that. That's all stuff to consider as well. If you're applying at a 0.6 FTE, is that going to be suitable for your lifestyle and what you need to survive? With that though, once again, you can always have a chat with your boss and say, is there a possibility that I might pick up some extra shifts? So there won't be permanent shifts, but you have the opportunity to just put your hand up, say, if there's any sick leave, I can take it. Things like that. And that's all just about keeping that communication open, because once it's open, it does really work and you develop a good rapport with your managers. Here we have a breakdown of what the recruitment process is. So across the state, there's now a centralised recruitment process. So every application, regardless of if you're applying for the Women's and Children's or Sejourner, all go into the same system. With the applications, you have the opportunity to apply to 4 sites using just the one application. With that, once again, you need to consider your choices. If you're picking 4 sites, you go, oh yes, I really, really, really want to work in the Riverland. And so you pick 3 of the hospitals in the Riverland, and then you go, oh, and I just need to pick somewhere else for it to be number 4. So I'll say Corn. Don't just do that, because there is potential there that you might be offered Corn. And if that's not really where you want to be, it's not fair to yourself, and it's also not fair to other people who might really want to be at Corn to just put it down as an option for the sake of an option. For a lot of these sites, they want to create some workforce sustainability. They want to keep their TPPPs on as much as they can, things like that. So it's hard when you have TPPPs that come to a town with the mindset that they're only there for a year and then they're gone again. With the application process, it's all online via the SA Health e-recruitment system, and that's the system that you use whether you're a TPPP or whether you're a nurse unit manager or director of nursing. In that system, there's the ability to edit and save your application right up until the closing date. So I strongly recommend that you utilise that option. If you haven't already logged in, log in and start filling in at least your demographic stuff. So your name, your address, email address, things like that. With that, with your email address, make sure that you use a personal email address. Try and avoid using your uni-based email addresses, because as soon as uni finishes, your email address goes away, and then there's no way to contact you if that's the details that you've put in the recruitment applications. Use the application checklist as a guideline. So one of the tools that's there is absolutely a checklist. It has a list of what you need to provide. You can print it out and tick it off as you do it. The reason why I'm highlighting that as a point is because if you don't follow the application checklist and your application is not complete, it's not considered. So you need to make sure that you are meeting the criteria and addressing all of the points that they want you to in the application. The other thing as well there is that a cover letter isn't required. It's really important as well to consider who you're using as a referee. So the recommendations in the frequently asked questions for the TPPP state that the referee needs to be someone that you have worked with, who has supervised you in your clinical placements, and it has to be someone who's been a nurse for at least 2 years. There are other criteria there as well, so I would suggest that you go through and look at the frequently asked questions to see what the guidelines are there. The other thing that's really important with referees is touch base with them, give them a call, send them an email and say, is it still okay if I use you on my application? Do you remember who I am? Things like that, because it's awful to put down someone as a referee and they can't recall the experience of working with you, or they are not even aware. So they might be on leave and things like that when the referee checks are happening. Here are the key dates for the 2021 applications. So the applications open as of Monday the 6th of July and then close on the 3rd of August. So they're open for about a month. So give yourself time to complete it. Don't feel like you need to rush and get it done in the first week, because the truth is it's not going to be looked at until after the 3rd of August. So take your time to complete it sufficiently. Make sure that all of your stuff is authorised and signed off. If it's asking you to show that, like change of name and things like that, that it's a certified document. Reference checks happen in the first week of August, and referees have a week to complete and return reports. So that's sent out as an email generally through to them for them to complete, or a link for them to complete online, and then it gets filed back in with your application. Then there's an assessment period which takes time over a month to 6 weeks, and that's where there's a whole board of people that review all of the applications and check things like priority of employment criteria, and that you've included all of your clinical placement reports, things like that. And this is where it gets filtered out. If you haven't got the right information in there, you get moved over to the pile of didn't complete. Okay, and then as of the October, there'll be an email out notifying you of your application outcome. With your outcomes, there is generally one of 3 responses that you receive. The first one will be congratulations, you've received a TPPP at Mount Barker or wherever you've applied and wherever has accepted you. Second one will be congratulations, you completed the necessary requirements to obtain a TPPP. However, at this point in time, there is no available positions at your nominated preferences. And the third one will be, unfortunately, you were unsuccessful. If you receive that second email where you were successful but there was no places available, you go back into a pool for second round offers. So if someone's offered a position and for whatever reason they decline it, then it will be re-offered. And from that pool of applicants, there's opportunity that you may be offered a second round place. Here we have the Transition to Professional Practice Program website. So you would have all looked at this, I'm confident. So if you look down on the right-hand side here, there's a little menu and things, and highlighted in red there is the application guidelines, so the frequently asked questions. So it's 15 pages or so of questions that other people have already asked. So if you've got something that you're burning to know, check in here first, because chances are that someone's already asked that question. If the answer isn't there, down at the bottom of this menu is the option to contact us. That goes through to the HR team of the Workforce Strategy Group, and they will address that for you if it's a HR related question. If it's a question specific about a site, so if you're wanting to know does Mount Gambier offer a dual RM and RN position, things like that, then they may steer you back through to make contact with the people that are listed on the information sheets. So that's the other box that's highlighted there, is the LHN information sheets. This is where you go to look at what the hospital is about, what's the size, what's their offer, kind of thing. So in these information sheets, it will give you basic brief rundown of the hospital with maternity services and an operating theatre and an ED and 25 acute beds. And then there will be also a contact person. So if you have further questions specific to the site, give that contact person a buzz, give them a call or send them an email and just introduce yourself and just ask whatever questions it is that you might have. If you want to know more, as I said, you need to contact the person listed on the information sheet for your preferred site. Have a look on the SA Health website for any information regarding the TPPP, so that website that we were just looking at. You can also contact the Rural Support Service, so send through an email to the team that I'm part of, and they, as I said, will either address your problem and assist you, or else we'll direct you to who it is that might be able to answer that question for you. Emailing through to healthjobs@sa.gov.au, that is the email address that's in that contact us box on the TPPP page for specific recruitment questions. They can also be the ones that might be able to answer questions about FTE and things like that for you as well. So full-time equivalent, that stands for, sorry. And take a visit to the town. Particularly if you're looking at relocating, go there, have a look around, see what the town has and how you feel about it. Contacting the local tourist information service is always good as well, because it gives you the opportunity to see what you might be able to do on your days off and things like that, because it's really important to have that work-life balance. And if you can't find it, so for example, you're mad about sailing and you take a TPPP at Roxby Downs, sometimes that can be really hard. If sailing is your relaxation thing that you do and you're in the middle of the desert, it's not going to happen. So take the time to find out information about where it is that you're heading. And so that concludes it all today. So thank you very much for listening in on the TPPP in the Regional Local Health Network information session. As I said, any questions, please direct them through to the clinical development team at the Rural Support Service, and we will try and help you answer your question. Good luck in your applications, and all the best for things in the future. All right, thanks everyone.